Morning, Corey. How are you doing today? I'm Leslie. I'm going to be your nurse practitioner.
I'm good. And yourself?
Nice to meet you.
Nice
Okay.
to meet you as well.
I'm going to start off with doing your lung assessment. Have you been having any shortness of breath, any problems breathing?
No.
No? Okay. Perfect. So I'm just going to expect your anterior, which is the front, posterior, and your lateral. And walk around here. So nothing sticks out to me right away. Everything is symmetric. I don't see any bruising, any trauma. So now I'm going to assess your respiratory rate, your rhythm, and your effort.
Okay.
So I just would do his respiratory rate, would watch the rise and fall of his chest, and I would count that for about 30 seconds, and then multiply by 2. A normal respiratory rate would be anywhere between 18 to 20 breaths per minute. He's not using any accessory muscles. If he was, that would lead me to believe that he would be having trouble breathing. Okay, next I'm going to palpate the chest for tenderness and lesions. So, does this hurt at all?
No.
Any tenderness?
No.
I don't feel any lesions. Okay. Okay, so I'm gonna check for thoracic expansion. Can you face your back to the... So how I would do that, perfect. For thoracic expansion, I would place my hands right here. And can you breathe in? Good, and out. Thank you, very good. Just gonna have you sit like that. Next, I will percuss the posterior, starting up here, using my middle finger. Then using my other finger, I will strike it really fast and just do it in a pattern. Down the back. Go laterally, which will be easier to do like this. Switch sides. Okay, perfect. And since he's already posterior, I'm going to go ahead and oscillate breath sounds. And I'll start right up here. Can you take a deep breath? Out. In. Out. And you go side by side to compare each side, and you will start from the apex of the lungs to the bases. Deep breath. Out. And I'll do the other side. In. Out. Go down here. In. In. Out. Go here. In. Out. In. Listen laterally. In. Out. Other side. In. Out. So lungs sound good. He has good air movement. I don't hear any wheezes or crackles or rhonchi. Okay, can you turn around and face the camera for me, please? Okay, so I have posterior percussion left. And I'll just start right here. So when you're percussing, you're looking for, if you hear a dullness when you percuss, that is to show that the lungs are fluid filled. If you have generalized hyperresonance, that's hyperinflated lungs like COPD and asthma, and that can also be characterized by a barrel chest. So when you're looking, just making sure everything is symmetric and his chest isn't barreled or pigeon. Okay, let's move on. Next, I'm going to inspect the precordium, the 6 areas of assessment. And we've got, let's see, the aortic, looking right here, which is like the second intercostal space. Aortic, pulmonic, over here. Epigastric, it's right down here. The apex of the heart is right up here. And then the mitral and the tricuspid would be right here. So I'm just inspecting. I don't see anything poking out. Do you have any chest pain? Do
No.
you feel any palpitations, rapid heartbeat? Okay,
No.
good. Okay, next I am going to palpate for a heave. And I would just hold my palm. Let's see, hold my palm and finger pads flat against the chest. Then I guess I'm just looking for a rhythmic lift to my fingers, and that would indicate an enlarged left or right ventricle. Next, I'm going to palpate for thrills. I would take the ball of my hand firmly on the chest to check for a buzzing or a vibrating sound. I don't feel that. And then palpate the apical pulse in the left lateral decubitus position. Okay, can you lay on your left side? Can you face the camera? Can you turn?
Oh, sorry.
That's okay. Okay, this is the left lateral decubitus position. And I will palpate the apical pulse. Let's see. Should be between the 4th and 5th intercostal space. So once you palpate that with your hand, then you will move to just one finger and just see if you can feel that, while constantly asking, is this tender right here?
No.
Okay, thank you. And just stay like that for a second. All right, I'm going to auscultate the aortic, pulmonic, tricuspid, mitral, those. And when I auscultate, I'm going to use my diaphragm to listen for S1 and S2 sounds. And to listen for S3 and S4 sounds, you would use the bell, because it picks up lower resonating sounds better than the diaphragm. Okay, so I'm going to start with him laying left. And I'll start up here. Can you take a deep breath? Out. Good. And then pulmonic. In. And I hear the S1 and S2, love dub, love dub, love dub. Okay, I'm going to move down to the tricuspid. Good job. And then the mitral. Then here is the apex right here. And the epigastric is right down here, kind of above the belly button. and that sounds good. And you would listen, he's lying left lateral. I would also have him lie supine. Supine is just lay your back down. This is supine, and you would listen. And then sitting up, you can sit up and face the camera. You would also listen just like this. So those 3 positions.
It's still recording.
Yeah, it's still recording, the green light's on. Sorry, the camera cut out, so we can't really see ourselves. All right. Next is the inspection, palpation, and auscultation of the carotid arteries. So let's see. I believe when I'm doing your right carotid artery, I would stand and use this. Just palpate it. Okay, I can feel that. And then to auscultate, I'll just take my stethoscope and okay, very good. Okay, next we're gonna do locate palpable pulses. So let's start off with your radial pulse. Let me come to your right side. If you can just hold your arm out like this. Got the radial pulse right here. And then with the arm out, the brachial pulse is right here. Awesome. The dorsalis pedis is, can you scoot back and put your foot up here, please? The dorsalis would be right down here on the top of his foot. The posterior tibial would be right here. And then the popliteal would be right here at the knee, right in the back. So those are all the palpable pulses. Thank you. Okay. Next, we are going to inspect the abdomen in a supine position. Can you go ahead and put your back down? And I'm going to grab a pillow. Can you lay sideways, please? Thank you. Can you lift your head up and have you lay on a pillow? There we go. So I'm just looking for, do you have any abdominal pain, constipation, diarrhea?
No.
I'm looking, I don't see any lesions, any bruising, any obvious signs of trauma. Okay, make sure they have an empty bladder. So next I will do auscultation of all the quadrants. We've got the right upper quadrant. Just listen in for bowel sounds. Left upper quadrant. Left lower quadrant. Right lower quadrant. Okay. Bowel sounds are normal. Okay, we're gonna listen to the aortic. Just right here. The femoral, which is right down here. Okay. Can you sit up for me? The renal arteries would be back here by the kidneys. Perfect, thank you. You can lay on down. Okay, percussion of the abdomen in the 4 quadrants. Go to the left upper, left lower, right lower. Okay, sounds good. Ah yes, percussion of the liver span at MCL. I'm gonna do the hooking technique because that's easier for me. So I'm just gonna take my right hand. Oh no, my left hand, flat on lower right rib cage. Okay, yeah. Yep. Hook it right there. Can you breathe in? Is that tender at all? Does that hurt? Awesome. So I'm just feeling the liver span, gallbladder. It feels, I don't feel any abnormalities. So that's good. And then the left hand flat on the lower right rib cage. Okay, this is the spleen. So I would percuss for splenic dullness. Can you turn to your side for me this minute? Just a little bit. Yeah, and just relax. The spleen is right down here. I'm gonna check for splenic dullness, which would be a sign of splenomegaly. Okay, perfect, thank you. Light and deep palpation of the 4 quadrants. So light palpation, just, you know, real light. Oh no. Just a second. My Adobe. Am I still taking the video? Okay, sorry about that. Something popped up on the screen.
Okay,
It's still going.
It's still recording?
Yeah, it's still going. The light is green. Sorry about that. Okay, yes. And then deep palpation would be really just my 2 hands and just deep. Are you having any tenderness?
No.
I'd be checking for rebound tenderness, which is when I push down and then let back up, it would be tender. That's rebound tenderness. Okay, so the Murphy sign is the right upper quadrant pain and tenderness, which suggests acute cholecystitis. So yeah, to assess the Murphy sign, right upper quadrant, rebound tenderness. Anything?
No.
No? Great. Okay, and the McBurney's point, here's the belly button, so it'd be a little bit lower. And this is checking for appendicitis. Any tenderness? How does that feel right there?
That's good.
Good? Okay. That's the McBurney's point. CVA in rebound tenderness. Okay. Right kidney on the right side, use the left hand to lift. Okay. So I'm gonna, my left hand is under his right side where his kidney would be, and this is my right hand, and I'm just gonna palpate. Try to palpate the kidney. And checking for any CVA. How does that feel?
That was good.
Great. Okay, next I'm going to pulsate the aortic pulsations. Let's see, which would be the easiest way? You can lay, can you lay flat? Yeah, lay flat.
Sorry.
You're okay. And then to do that, you would put your hand one on each side and just kind of press firmly. See if you can feel that. Okay. All right, let's see. I believe we are done. Thank you very much for letting me assess you today.
No problem. Appreciate it.